Four Hearts Worldwide and Pacemaker Club are excited to bring you Cardiac Café, a conversation on heart health and everyday living. This series will explore important topics on cardiovascular devices and what it is like to live with them as a recipient. Join us in the Pacemaker Club video library for knowledge, support, and stories that connect our heart health community.
Hey everyone, and welcome to the Cardiac Cafe, sponsored by the Pacemaker Club and Four Hearts Worldwide. This episode, today, we're going to talk about pacemaker follow-up appointments and how to self-advocate and get the care you want. Our speakers today are myself and Dr. Jones. Dr. Samuel Jones is a cardiac electrophysiologist. He's the director of inpatient electrophysiology at Memorial Hospital, Chattanooga, Tennessee, and he's an electrophysiologist at the Chattanooga Heart Institute. He's also a retired colonel from the U.S. Air Force. Thank you so much, Dr. Jones, for being with us. My name is Linda Marie. I'm a registered nurse and a nurse educator, consultant, and health coach. I'm the director of community development for HealthWise and Happy.com, and also the clinical program development consultant for A Quality Agency, LLC. So thank you, Dr. Jones, for being with us today. We're going to talk about, this is going to be more of a casual conversation between Dr. Jones and I to explain to you how to advocate for yourself. And in doing that, our agenda is to first ask, listen, and lead, advocating for yourself, what to do with pre-appointment prep, and how to handle yourself during the appointment, post-appointments, and then we'll have some final thoughts for you and maybe some extra tips on things you can do to self-advocate for yourself in your care. So Dr. Jones, if you'll start here.
Great. Yeah, thank you so much for allowing me to come. I think Linda and I are going to have a great time speaking with you all today about what we're wanting to talk with you about, getting the most out of your appointment. And I think this is something when I talk to my patients quite a bit, because the reality is the nurse that sees you, the nurse practitioner, or the doctor only sees you a very small part of your entire life. And so what we have to do is make sure that we're getting the most out of that small appointment time so that we don't waste any of the time. You get all the questions answered that you have. And that's what we're going to try to do today. We want to make sure that when you go to the clinic visit that you're actually feeling like you're heard. And there's some tools, tips, and techniques to try to make that happen. You need to understand what is your diagnosis. I think that's critical. And then along with that, what are the symptoms? What's going along with that? And then what are the things I have concern about? Particularly today, we're talking about pacemakers and devices and defibrillators. But in truth, it's every time you go to a clinic visit, these are some of the things that we want to make sure that you're thinking about to get the most out of it. I've been a patient. Linda, you've been a patient before. What are some of the things that you may want to go ahead and add here?
Yeah. Thank you, Dr. Jones. I myself am also a pacemaker recipient. So not only have I been a nurse working with patients on advocating for themselves and helping to advocate for them, but also as a patient, I've had to advocate for myself. So I definitely do have some experience on this. One of the things we really want to accomplish here is to help you to understand how to feel heard, and that you have a good relationship with your physician and your team, the rest of your care team, so you feel like you're really getting the care you need. So in doing that, learning how to advocate for yourself is so important. If you don't, you're going to find that you may not feel like everything's being addressed. And it's not always easy, and it takes a lot of courage to advocate for yourself and a lot of practice and the willingness to ask a lot of questions. The more you practice this in your healthcare, the better you're going to get at it. So we're going to go into some details to give you some ideas of how to do that. So our next topic is how to prepare for your appointment. So what do you do while you're getting ready for your appointment? So this is one of the most important things, because you have time to prepare for your appointment and what you want to ask the doctor or the pacemaker clinic or another provider like a nurse practitioner or PA you might be seeing. So you want to make sure you bring them the right information, because you only have a certain amount of time on that appointment and they only have a certain amount of time for you. And their overall goal is to really help you during that appointment. So in order for them to help you the most, you're going to have to come prepared. Now, sometimes visits just happen because we have problems, but in that case, you won't have as much time to prepare. But no matter what, Make sure you always have a list of your medications and included allergies, because they're going to ask you each time, because they need to make sure if anything changed, so they're giving you the correct advice. Make sure if you're having any pacemaker problems that you have written those down, symptoms you're having, what does it feel like to you? How does it impact your quality of life? That's really important. The doctor wants to know, is this making it hard for you to work? Is it making it hard for you to socialize? So giving them a clear picture of how it's really impacting your life so they know how to help you. And then you always need to carry your pacemaker card with you, just no matter what. So keep it in your wallet or in your purse. Important to have that information. And then have a written list of questions with your priorities. So once again, there may be some limits on time. So make sure you have your questions in priority order. And I know myself, sometimes I have all my questions and I still forget to ask something during the visit. So don't forget, you can always message. You can message the clinic or call the clinic after if you just forgot something. So don't get too stressed about it, but try to have everything written down so that you can bring up the most important things during your visit. If it's your first visit with a provider, you definitely want to create a timeline. So one thing I've done that's really helped, and all the providers I've brought it to have been really happy I have it, is I just typed up a document, and you can handwrite it, whatever, however you can do it, but just creating a timeline of when my cardiac problems started, some testing I've had, the dates, where did I have that in case they want to get medical records, like what was the facility, who was the doctor, what state was it in? Those kind of things help them. Any diagnosis that you have, if you have a list of diagnoses or symptoms, tests, it doesn't need to be like pages and pages, but like a 1 or 2 page, like bullet pointed timeline is really going to be helpful for them to understand, particularly surgeries and where you had those. And then for follow-up appointments, you're going to deal with anything that's unresolved, right, from the other appointments. So the first appointment, there's so much information. It's hard to address everything, but the doctor's getting to know you, and you want to make sure that you make the most of that time. So Dr. Jones, you obviously have seen hundreds and hundreds of patients, right? So what will be your input on what's the best way for pre-appointment prep?
Yeah, so I feel like you're calling me old with the hundreds and hundreds, but I'm gonna gloss over that for the moment. I think these are critical. I really do think that making sure that as you go to the appointment that you have a good understanding of what you're trying to get out of it, and that you partner with the clinician so that they're not having to spend time going back. Now, they may have actually done a lot of this work before you get there, but sometimes there's something they just didn't quite know. And if you have it already there, easily accessible, that just makes everything run much smoother. I always tell my boys that failure to plan is planning to fail. And so making sure you have an idea, an agenda in your head about what's going on, but have some of that information. Now, it is true, maybe not all that information is something that they really need at that time, but it's better to have it and not need it than need it and not have it is just a typical thing I want patients to know. But many times they'll have something that they bring and I'll say, yeah, that's exactly what we're looking for. It turns out that had not been sent to us, had not been faxed to us. We're one of the few places that still have fax machines in your hospital. And so bringing that with you, it really is critical. And it helps with that partnership so that you know. And there is a difference between the first appointment, in which many times you're trying to understand all of the things that's led up to this moment in time, which is critical. But then the follow-up appointments, a lot of that stuff, it's still good to have, but it may not need to be going through again. But what is important is what happened since last time. And I think that sometimes as we're going through the appointment I'll have with a patient, we kind of forget to talk about something. And as we're getting ready to leave, they said, well, what about my hospitalization last week? And so that's one of those things where we need to reset and say, well, let's talk about that. What was that about? And so at the follow-up appointment, it's really that interim time. What's changed since then? Did I have hospitalizations, ER visits? What are some of the things that I noticed with the last changes that were made? In other words, the pacemaker was tweaked a little bit in this way. How did that make me feel? And the more that you have that during the pre-appointment time, you're ready to go, that's going to make it run much, much smoother. So I think everything before the appointment is important. Probably we need to talk about the actual appointment now and what goes on there. Unless, Linda, do you have anything else from pre-appointment you want to talk about?
No, I think you brought up some really good points. And just so you know, I wasn't trying to make you feel old. Plus, I'm probably older than you. No, I think we've covered it pretty thoroughly. And I think the main thing is for the patient to really feel more in control of their care. So the whole point of our conversation here is to help you to feel very in control of your care instead of out of control of your care. When you have so many things going on, you might feel a little out of control with your health. So we want to help give you some predictability and some empowerment for understanding how you can be part of your own medical team. So during the appointment, you want to, if you can, now see this picture here, Dr. Jones. This is you at an appointment, right? See young Dr. Jones?
Something like that. Something like that.
Right. And so bring a support person with you if possible, and not always. I mean, I go to a lot of my appointments by myself, but if you have a support person that can go with you, they can help to remind you of things. Try to focus on your main and most important issues first. So typically that's going to be unmanaged symptoms and device problems, because that's going to impact everything else. So make sure you're dealing with those first, so the physician or other provider you're seeing has enough time to work with you on those, or get you into the device clinic if they need to, or even have you see the doctor if you're seeing a different provider like a nurse practitioner or a PA. Always ask for explanations from the doctor or your provider in the device clinic, because you're going to learn a lot. And I know a lot of people don't like to learn about a lot of the medical stuff, but the reality is, when the more complex your health problems get, or if you have devices, you're really going to be happier with the care you get if you learn at least, basics about what's going on with you and your devices. So ask and help them help you, right? Help them to help you understand what's going on. It's going to take time. I'm a nurse, and it took me probably a year to learn a lot of the basics of my pacemaker, because it hasn't been my focus in the past. So give yourself time to learn, and just know it's going to take some time, but learn the most important things first, and ask the device clinic, what are the most important things I need to know about my settings and about my pacemaker? And they'll help you learn, and your physician also. So always ask about a follow-up plan. One thing I find that helps me and all the patients I've worked with over my many years in healthcare is that if you have a plan, then it helps to give you security and safety. So if you don't feel like anybody's explained to you what your plan is for care, they have a plan for you. Maybe they think you know it or understand it, but if you don't, always ask about what your plan is, and what your follow-up plan is, and any options and choices you might have. So that's going to empower you. Absolutely. For the device clinic transmission reports, so my experience from being on the Pacemaker Club forum is that a lot of people don't understand the pacemaker or other device transmission reports and setting changes. So ask the clinic or the physician, how often are the transmission reports going to be sent? If you have an app, or if you have the device next to your bed, make sure you understand how that works, so that it's connecting enough, and that when there are reports, that you understand if there was anything that made them want to make changes, just so you're really understanding how everything works. And that also will give you some safety and security for understanding what's going on. And then once again, ask questions. From here, I'm going to turn it over to Dr. Jones, but I just want to say that device clinics are different everywhere. So they're different at every physician's office I've ever been to, and from other people I've talked to, they're all a little bit different. So you want to learn your device clinic. So what we're talking about is a little more general. Your device clinic might be a little bit different. So Dr. Jones, what's your experience with this?
No, I think that's critical. I think everything that you said is right on. A few things I would probably highlight. I like how you said bring a support person if possible. And a lot of times it's just not. But if it is, those people are critical, because there's so many things that are going on in the appointment, and the patient's thinking about trying to think 3 steps ahead. They may not be thinking about currently what is being discussed. So that's also helpful. The other thing I will find, though, if it's a son, a daughter, a spouse, a friend, sometimes we find out that the patient kind of forgot something, or maybe minimizing it. This is very common, where you'll say, well, how are you feeling about this? And they may say, it's no big deal. And then the spouse may say, don't you remember you told me a month ago this wasn't good? And so that helps actually bring out some of really what's happening. And so I think these people that surround us in our lives probably have a good view of what's going on and kind of help us with that as well. I do think the main issue first is always important because we want to make sure that we get the critical issue and get that addressed before we go down many other things, because sometimes the appointment just goes like the appointment's going to go, and we may lose sight of that. So I think that's really important. And when you talk about what that main issue is, it needs to be, what are we talking about exactly? Is it a shortness of breath? Is it a discomfort? Am I worried about this with my pacemaker? What is it? And then if there's some symptom that you're having, it also needs to be when and how. In other words, is it every day when I walk? Is it just when I go upstairs? Is it after a meal? Is it when I turn over in bed and I've noticed something unusual about my device and that's concerning me? Well, really, when is it this occurring? And I think that that's critical as well. And how do I do something that makes it worse or better? All of those things can be helpful. So really going around that symptom, as much explanation as it can happen, I think really helps communicate and gets that team approach with your medical team much better. And yes, if you don't understand it, ask for explanations, because just like when I take my car to the mechanic, they may run off a lot of gobbledygook that I just don't understand. And I say, you just need to tell me as a non-mechanic, what is this? Or if I go talk to IT support and they tell me about all these things, just give me the bottom line here. What's going on with that? And sometimes I think that patients will say that there's a miscommunication. They just don't quite feel that. So that is something that can be helpful. And then the follow-up also is important, so that we know sometimes just a good summary at the end, either from the person you're seeing or from you. All right, so what I understand here is that things look good at this moment. We're going to we're just going to watch this again in 6 months and see where we are. Or we're going to do this. I think just a follow-up is really critical there as well. So those are all things with the appointment. And now we go to after the appointment. What are some of the things there that we really have to? And again, I would say data is very important. What happened to your heart rate? What are the symptoms? Any changes that we made? What is that? And if it's going to be a follow-up appointment, that's good. Or if the follow-up appointment didn't get made, how do I actually call back and make sure that I get some of those things so that that is answered? Many of this will be from the transmissions from the device directly to the clinic. And so there is a lot of data here that comes on, and but it's not all the same thing as what you're feeling as a patient. So I think that's critical. Linda, what else would you add here?
I would add here that after the appointment, if you don't take responsibility for doing some of the things we're going to talk about here, it's difficult for the physician to help you. So we do know sometimes the patient is talking about all their problems and they're not being listened to, but we aren't talking about that yet. Right now, we're talking about if your physician's listening to you, you have a good relationship with them, and you want to really advocate for your care. So you have to take responsibility after. So now you're preparing for the next visit and taking responsibility for your health in between visits. So in order to do that, you need to track. If you're having, sometimes people get a pacemaker and everything goes great. There's not a lot of problems, not a lot of symptoms, but maybe you're still working on settings or you're still having symptoms. So you really need to track. And if your blood pressure is a problem at all, or your heart rate, you want to make sure you're keeping logs. So however you do that, digitally, in a device, on a piece of paper, the physician is going to like to see how your blood pressure is before they make any changes to your blood pressure medication, say. So anything that you're tracking, then make sure you bring that log into your visit. So it may or may not be relevant, but you'll have it if it is. And especially if it's out of the normal range. So if your blood pressures or heart rates are running high or low, you certainly want to show the doctor so that he or she can really take a look at, what the trend is. And if you put times on the logs, they can see too if it's different times of the day, because maybe your medication doses need to be changed for timing versus dosage. So that's something they're going to be able to see if they can see the trend. So if you can help show them that, that's really helpful. And if you have a caregiver or somebody that can help you with that, and it's not something that you do, but they do for you, then either bring them or bring their log with you to the appointment. And then, of course, reach out to the team. So one of the things I find as working as a nurse is that people wait a very long time to reach out to their doctor sometimes. So I would say don't wait too long because you don't want your symptom to get so severe that they need to see you immediately or you end up in the emergency room, which sometimes happens outside of your control. But try to, whenever possible, reach out early on so they have some time to respond to you and maybe make some changes. Or if they need to see you right away, they have at least days to fit you in your schedule instead of hours, right? So try to work with your team to help you when you're having problems. Making sure your transmissions can happen after the appointment. So I have an app on my phone, but if my Bluetooth is off, my transmissions aren't going to happen. It's not even going to collect data. So make sure you understand whatever device you have and how the transmissions happen, whether it's an app or a bedside unit, that you make sure that's connected when it's supposed to be, that your transmissions are happening, and that you talk about those transmissions when you go to your appointments. So also symptom management, it is important, and your health is important, your life is important, and symptom management is important. So you shouldn't walk around every day feeling like crap. Basically, you just shouldn't. If you're having problems, then talk to the doctor. Don't think this is just the way my life is going to be, because most of the time they're going to be able to help you to have a better quality of life if you do the things we're telling you to do. So, like I said, there are situations outside of that, and we'll get into that in a moment. But in most situations, you can deal with your medical team on your symptom management so you can have a higher quality of life, and the symptoms you're having are managed well and not impacting your quality of life or your day-to-day enjoyment of your own life. So, Dr. Jones, what else would you like to add? What else do you think is helpful for
I think the
patients?
other thing I will say is that pacemakers and cardiac devices are amazing, and they do so many great things. There are some times, though, in which the symptom just may not be due to that. And I can think of several patients I've had where maybe they said, I'm just so weak. I thought this was going to solve all of that. And it turns out the pacemaker was doing everything perfectly. But then we found out they had a thyroid disease, or their primary care found out that there was something else going on. Or sometimes the patient said, I'm still short of breath. And turns out maybe the patient has asthma or something else that's going on. And so I do think while we see a lot of benefit from these devices, it is something that we have to keep working across all of the care teams to make sure that there may be something else going on and we just need to get it looked at. And sometimes that's kind of frustrating, I think, for patients to think, I thought this was going to be the magic thing to take care of it.
Right.
Many times it is. But if it's not, don't give up. Just know that it may mean you have to go see the lung doctor. It may need that we have to go back to the primary care, make sure that all of those other things that can do it, that they're still working okay. And I think that that's one of the things that's critical. Just keep moving on. It just may not be always in the pacemaker clinic. It may be somewhere else.
Yeah. Yeah, absolutely. I agree. And sometimes your electrophysiologist is going to need to add another cardiac or other type of specialist to your team in order to help you with that, like Dr. Jones said. And if you're doing like we recommended and bringing all those symptoms in and all your problems into your visits, they can help to make that decision more directly for you. One thing I want to say is sometimes you just need a second opinion. So sometimes you've tried everything, and maybe for whatever reason, it's not a good match with a physician. And it's just the same with any kind of service we get in our life. And if it's not a good match, then don't be afraid to get a second opinion. It's common practice and acceptable to get a second opinion. And you might find out when you get a second opinion, well, I really like the electrophysiologist I'm with. He really listened to me, or she really listened to me better. And they're saying the exact same thing. So I'm just staying where I'm at. And it strengthens the point of the electrophysiologist you're with. But then you might find out something else. You might find another electrophysiologist that can help you a lot more. Maybe they have different experience. Maybe they have more tools and a bigger healthcare system. So if it's not working, just like any other part of your life, then do something to help correct that. And it's common practice to get a second opinion if you need a second opinion. So don't be afraid to do that. And certainly if it's not a good fit, you should have a physician that's a good fit for you. I mean, it works best on both sides, for the physician and for you. If it's a good fit, to stay, and if it's not a good fit, then maybe start looking. So once again, it's about you having an experience, higher quality of life, and that your life is a priority and very important. So I hope that you'll take some of what we said and put it into your care for yourself and for dealing with your healthcare team and your device clinic, and that you will have a better experience by doing some of these things. And certainly, we will follow up with more episodes to give you more information about how to live a higher quality of life with a device and dealing with your healthcare team and your health in general. So we have some resources for you here. And I think most of you know, a lot of you are coming from the pacemakerclub.com, forhearts.org, one of our other parent organizations. And we want to really thank you for being here. And I thank you, Dr. Jones, for presenting this webinar with me. I think we put together a lot of good information for the Pacemaker Club. So thank you all.
Yeah, I would just say that's been great. Thank you all. Thank you for the opportunity. And the number one thing we always say, just communicate. I need to have a trusting relationship with whoever you're working with. And I definitely like all of the resources that you showed there on the last slide. American College of Cardiology also has some. So there's a lot of different ones. And I think that helps empower a lot of patients because there's a lot of good information out there and then maybe some information that's not as good. So trying to get it from a trusted source is really good. Yeah. But this has been great. Thank you so much, Lena. Really enjoyed it.
Yeah, my pleasure. It has been great. Thank you. And thank you all for tuning in. Take care. Bye-bye.